The reason to get screened for colorectal cancer is because colorectal cancer is the third leading cause of cancer and deaths in the United States. 90% of it is preventable, so we look at colorectal screening as a beneficial test to prevent cancer. The individuals who should be screened for colorectal cancer include everybody after or at age 50. And also if there are family members that have had colon cancer or colon polyps, the relatives of those people, including siblings or parents or their children, should be screened at an earlier age, about 10 years before the diagnosis of their colon cancer or their colon polyps were detected. And it's important to know that colon cancer is equal, unfortunately, in men and women in the United States. And so it is an equal opportunity disease, unfortunately. And again, it is preventable by 90%. And that African Americans and people of Jewish ancestry should be checked at about age 45, actually.
The colonoscopy prep is a relatively easy process. Once you have scheduled your appointment, you will receive a packet in the mail. You need to review the packet. You need to know what you have to do prior to your procedure. It will go through your prep instructions as well as a diet that you will need to modify. 7 days prior, you need to avoid flex seeds, peanuts, lettuce, tomato skins, popcorn, and alestro, which is a fat substitute that is often found in Pringles, fat-free Pringles, or Wow Lay's potato chips. The reason why you need to avoid these foods is because they're very hard to digest, and we want the doctor to clearly be able to see the colon and detect any problems. Your doctor has prescribed the MiraLax Prep. You can purchase these products, which are all over the counter, either at the pharmacy or the grocery store. You need to buy a 238-gram bottle of MiraLax, a box of Dulcolax laxative tablets, not stool softeners. You'll also need 64 ounces of Gatorade or 2 packets of Crystal Light lemonade that you'll mix with water. You'll need to pick up some clear liquids. Clear liquids are broth, Jello, Gatorade, popsicles, any carbonated beverage, coffee or tea, no cream. I say make it fun. Have as much Jello or popsicles, just nothing red, because red will discolor the colon. The morning before your procedure, you will need to mix up your MiraLax and your Gatorade in a separate container. Then you will place it in the refrigerator. And remember, you're not going to start drinking it until 5 p.m. You're also going to have to start your clear liquid diet. No solid foods. So that means your clear liquid is going to be breakfast, lunch, and dinner all day, as much as you want. At noon, you're going to have to take 2 Dulcolax laxative tablets, continue on your clear liquids. Then at 5 o'clock, you will start drinking your MiraLax Prep. That means 8 ounces every 15 minutes until half the preparation is gone. Continue on clear liquids. And then 6 hours prior to your procedure, so if your procedure's at 1, you will get up at 7 in the morning and drink the other half. Same process. 8 ounces every 15 minutes until it's all gone. If you're having any problems with your prep, such as nausea, vomiting, abdominal cramping, stop your prep for 30 minutes, then resume drinking 8 ounces every 20 minutes. If you can only tolerate half of your prep within 4 hours, you'll need to call the office at 937-320-5050. It's very important 4 hours prior to your procedure, you do not drink any liquids. You may brush your teeth, just don't swallow any water. You may take your medications with a small sip of water unless you've been told otherwise. It's very important for you to take your heart meds and your blood pressure meds. If you're on any diabetic medications, you need to check with your primary care doctor. If you're on any blood thinning medication, you need to notify the office because we will have to contact the cardiologist because you will need to hold it prior to your procedure. Do not chew any gum and do not eat any hard candy. Remember, you will be sedated for this procedure, so you need either a family member or a friend to take you to and from your procedure. We would prefer if they stayed. If they cannot, they will need to leave a contact number to get a hold of them. Due to safety reasons, we will not allow you to leave in a cab. The day of your procedure, you'll need to arrive an hour before your scheduled time. You need to bring a picture ID, your insurance card, a list of your medications. You'll be here about 2 hours from start to finish, and you will be discharged in the care of either your family member or friend. After your procedure, you may feel a little groggy. We suggest you take it easy the rest of the day. The next day, you should be able to resume your normal schedule, activities, and a normal diet. Let me just take this time to thank you for your trust and confidence with the Dayton Gastroenterology care team. If you have any questions, please call the office at 937-320-5050.